So today we're going to, well, today and actually the next 2 or 3 weeks, we're going to talk about this stuff about health promotion as opposed to disease preventing, if that makes sense. And so essentially, we're going to talk even more about public health dilemmas, especially on one side we have the duty to enhance the public health, and actually we'll actually talk more about what do we mean by public health. It might seem intuitive, and what we've been talking about the last few weeks is that has to be weighed against individual rights and liberty, and then the question we've been trying to answer is that what limits on liberty are justified to enhance the public health, and what limits on choice or autonomy is justified in order to enhance the public health. And we've been talking about these types of public health activities, and we've been justifying it in terms of harms to others, right? Harms to society. And also we used an extension of the harm principle, social economic cost. However, I think we still need to do some more work here. I mean, we can't always play this card, the social economic cost, because we're also limiting liberty and choice, and it has to be a healthy balance between the two, and sometimes it appears to be more in the continuum between promoting individual health as opposed to promoting public health. It actually appears to be more. It seems like we're doing more for individual health, I think. And this is, if you haven't memorized it already, I was thinking about leaving out the slide. I'm thinking that I know you've all memorized it already. It's like you say when you go to sleep and when you wake up, and probably have nightmares. But anyway, so the only purpose for which power can be rightfully exercised over any member of a civilized community against his will is to prevent harm for others. And I mean, essentially, one could call this the harm principle, or actually an anti-paternalistic principle, right? Because then he goes on, even his own good, one cannot be justified, okay? And there are good reasons to try to persuade him, entreat him, but not compel him. And over his own body, the individual is sovereign. So, getting back to this, I think I answered this question again, but our answer might change from week to week. So, what are the two most ambiguous terms in this sentence up here? This might be a guessing game, so we won't go on forever. So, so what do you think? When you keep on, when you find yourself repeating this, yes, right?
I see will and harm.
Will and harm. Okay, great. Will and harm, and look at that. Yes, I agree. Oh, yes. Are you seeing that? Oh, how's that? That's better, right?
Better.
Yeah, right. Okay, that's sound like the eye doctor. Better this way, better that way. Okay. Anyway, okay. So, all right. I knew the red wasn't showing up. That's why I decided to turn off the lights. Anyway, will and harm. Okay, excellent. Why did you say that?
I mean, when I...
You don't understand those words? What's up with that?
It's just that I'm coming to realize that in ethics, from what we're dealing with now, we're thinking about the will of the people and the public health itself trying to do something that might be in favor or against the person's will in order to execute or implement a measure that will reduce harm. So it's a matter of, are you willing, are you not willing to accept it, and then if it's going to harm you, it's going to harm everybody in the process of trying to
okay. Other thoughts about why those words are ambiguous? Yeah,
I think for harm is being able to determine what harm is, because harm for me may be a different harm for somebody else. We're trying to decide what that is for the general public. I think it's
okay, all right, good. Jennifer?
And harm could be psychological, biological. What kind of harm are you specifying?
Oh, okay, all right. Jackie?
Well, basically what I was going to say is that harm could come in many forms.
Yeah, harm could come in many forms, shapes and sizes, and well, I mean, and there's also a magnitude, right? A closely related thought, and then the probability, right? Probability of harm as well. So, and we all have, and then, you know, we like to think we have data, but as you have seen, sometimes we don't, and then what do we do if we don't have the data, right? What card do we use? What move? What's that? The precautionary principle, right? Yeah, we use that, right? And so we could, right? You know, justify anything when you think about it, right? No data, no problem. Precautionary, you know, what's up? So now, well, right? So what's up with that word, will? I mean, we don't want to go against someone's will, but how could that term be stretched or narrowed, actually, when I think about it?
Seems like one of the issues with the obesity thing is whether people are fully informed, quote unquote, and so whether they can truly exercise free will, voluntary or not, based on if they have the full information available.
Right, exactly. So depending on our concept of who's autonomous, or if someone is autonomous enough, we could, we could say that someone is not autonomous, and that justifies us interfering with the person. But for those in the directly in the health field, doctors, we've been accused of doing it all the time. Okay, you don't want to follow my advice? We'll get the psychiatrist in and call you incompetent, and then, well, that's a class for another course. But anyway, so this has a lot of relevance for the what we're going to talk about today, and actually for most for justification for a lot of public health practices. So okay, so before we get into talking about paternalism and hard and soft paternalism, I get the essence that that may be ambiguous terms as well, because different authors use it differently. So I want to make sure that everybody is on the same wavelength, or at least on my wavelength. Okay. But before we get into that, so what do you think about health promotion? I mean, that's what we're well, let me talk about this now. So the first major thing we talked about was quarantine, right? I mean, we talked about other stuff too, but quarantine, right? And then we talked about did we talk about last week? HPV. And today we're going to talk about obesity and now quarantine. How much health promotion was involved with that? Individual health promotion. That's what we're talking about when we branch into health promotion activities. It's not a trick question. How much individual health promotion was involved with quarantine?
None.
Yes. Okay. Right. Very little. Okay. You guys. Nothing's going to happen to you if you say the wrong answer. Okay. Very little. Okay. Very good. Excellent. Anyway, now HPV. I guess there was much more, right? Individual health promotion, and then of course there was also protection of other individuals as well, right? With the vaccine. In fact, herd immunity was one of the reasons why to maybe try to justify a mandatory approach, among others, including social justice. And so today, we're talking about obesity, right? So how much, between, promoting others' health versus individual health, what's up with the obesity campaign? Is it more for the individual person, or is it protecting harms to other individuals? Individual. Yeah.
I think you could argue both, because you're helping the health promotion of that person, but you're also collectively benefiting the society with less health economic costs, more workforce that you can get out of that person, less disability.
Right. Maybe I should have rephrased the question. Direct harms to others. Are there any direct harms to others from being fat?
No.
I mean, I guess I don't want to be politically incorrect, so tell me if I venture into that territory. But I mean, you could harm someone by giving them the SARS virus, right? If you harbor it, and so that's why we quarantine you, right? And then with the HPV, right, you could have the virus, and we don't want you to get the cancer, but we don't want you infecting other people as well. Now with the obesity, right, it's we're shifting over more in the continuum. It's more for that person, right? I mean, we'll talk more about enhancing the public well-being. That's in the equation, no doubt about it. But compared to the other two examples, we're reaching over another part of the continuum with trying to prevent obesity in individuals. So what do you think about the state or the government getting involved with changing health promotion? We're actually trying to change behavior, lifestyles. Is that right? What do you think? I'm not trying to say something profound here, but I just want to make sure we're all understanding. So what do you think about that? Changing behavior. That's Chris, help us out here.
I think it's a good thing because the government has an investment. They pay for oftentimes federal and both state and local to a certain extent pay for when people have certain illnesses. So I think they have a stake in health promotion in that sense, and they have a right to it.
All right, they pay for our illnesses, so they have a right to change our behaviors.
Yes, definitely.
All right, well, you heard it first. The government could change our behavior. Okay, well,
or try.
Nothing more to say. Okay. Other thoughts? Yeah.
I mean, I can kind of understand, promoting healthy like habits by making it easier to make healthy choices and stuff like that. But as far as like completely banning everything that's necessarily bad, that's kind of really invasive, and it doesn't give, it kind of takes away people's right to choose what they want. But making it easier to make the right choice and making it easier to eat healthier and to be active.
Oh. All right, so there's a so the government could get involved in trying to change behavior. I mean, actually, in medicine, right? We try to change our patients' behaviors. You know, tell them not to smoke, take your medicine. I guess that's a limitation, right? We don't put a tax on anything, but the government, I mean, as you can see, they could do several things to try to change behavior. So do we all agree that that to a certain degree the government could get in the business of changing behaviors to a more healthy behavior? Never mind what healthy means right now. Yes.
I don't mind it at all, but I think, like the article says, it can become a slippery slope where they start changing some behaviors, then they start making certain behaviors mandatory, and then they restrict certain behaviors. So I can see where the worry is that it becomes a slippery slope. Slowly, more and more rights are kind of taken away.
Okay. All right. Helena?
But then looking at it conversely too, for example, in places where it's like a food desert or whatever, then if the government is promoting, you know, some healthier food options, then nobody really opposes that, right? So it kind of goes both ways in terms of the government incentives or disincentives.
Right. So I guess there's some activities that could be on the table, and some activities that maybe it's a little bit too much.
I agree. I don't think you can depend on the free market to get people to have the right behaviors, because people just don't, they're just not aware oftentimes of how to be healthy, how to eat healthy. So at least if you have the government saying, well, this is what you guys should try to do, like the Let's Move campaign, try to get it out there, the information out there, then people can decide for themselves what to do, but at least there's a promotion out there.
Right, okay, so you're actually concerned about some members of our society's will because of, you know, all the bad stuff out there, market failures, right? In terms of, and we'll get to this in just a few seconds, like, you know, pervasive advertising, right? And we're not...
advertising.
What's that?
Misleading advertising.
Misleading, right. So, you know, there's three things you could do to people to try to convince them of your argument. Okay, right? So you could persuade them, right? You could manipulate them, or the information, or do psychological manipulation, or you could coerce them. Those are three things you could do to people to try to bring them over to your side. Okay, and persuasion is ethically appropriate. Manipulation is not good, and coercion, well, you know, that's not good too. What is coercion, by the way? Are we clear about coercion? You know, many times people say, oh, that's coercive. But what do we actually mean by coercion?
Coercion is, like last night, I was watching cartoons for about an hour.
Spare us the details.
But I saw
let me think of that cartoon. Go ahead. I was watching cartoons too.
I saw 3 TGI Fridays.
That's it, right?
Family Guy.
Family Guy, right.
And I saw 3 TGI Friday commercials. and it was for $10 I can get a Jack Daniel's cheeseburger and a pizza as an appetizer, and I wanted nothing more than to leave the house and go to TGI Fridays at that point in time. And I think that was a little bit excessive. I was very hungry. I could taste the burger at that time.
So, what, you were feeling coerced?
I only watched TV for about an hour and a half, and I saw 3, 4 of that same commercial.
So do you think that's coercion?
Yeah. I really could have left.
I think they were preying on a weak one.
A little bit of that too.
I mean, one could say that you were unduly induced to get that pizza or whatever.
Pizza hamburger.
Yeah, okay, I'm sorry. Pizza hamburger. That now makes sense. But coercion is when someone is in a coercive setting when if they say no, they're going to be in a worse off situation. Okay, so if someone says, if you don't eat my hamburger, I'm going to kill you, okay, all right, then, you know, obviously, I think you would be in a worse off situation if you said no, okay? So that classically is coercion, but anyway, so you got persuasion, manipulation, and coercion. Advertising doesn't, it's kind of hard to coerce you. It's mainly manipulation, and we'll see examples of that. But anyway, so health promotion. So we all agree it's okay for the government. Sounds strange, but it's okay for the government to try to change our behavior because you know we have the you know weakness of will, and we'll get into that more in just a few seconds. So anyway, so back to this. Let's start looking at what paternalism is. So essentially, prevent harms to society versus enhance individual welfare, and the extent of paternalism. Now, we've been talking about paternalism the last several weeks, right? That term has come up. Before we get into you know, roll up our sleeves and really start to talk about paternalism. How much furniture in here? You know, it's getting really... Okay. Paternalism is what? Who wants to... Actually, let me see. If let me just, yes. Let me just, I think, well, let me go back to, I'll get to the poll in just a second. So what is paternalism? Someone wants to?
Learn to do something because it's good for you.
Okay, all right, and that's all right, good. So, and based on that, which one is, well, you know, the most which practice exhibits the most degree of paternalism? What's that?
I would say in terms of strict paternalism.
I mean, I guess with the paternalism, you're doing something for their own good. Okay, so quarantine, you know, minimal stuff for their own good. HPV vaccine, you could, you know, say it's for their own good too, but as I mentioned before, obesity, it's, you know, and the HPV vaccine, it's more, you know, also harms to society, prevent direct harms to society, and enhance individual welfare. I mean, that's in vaccination, but again, with obesity, it's more, it's almost more exclusively we're talking about paternalism, doing something against someone's will because it's for their own good. Well, let me just yeah, right. So yeah, let me just get, the hard thing about crafting these PowerPoint slides is you never know which way you guys are going to lead me in the discussion. So anyway, here's a very a definition of paternalism. X acts paternalistically towards Y by doing Z or omitting something as well. X does it without the consent of Y. X does it just because Z will, the thing Z will improve the welfare of Y or promote the interest values of good of Y. So, and the major thing is that whatever you're doing, like the vaccine, all right, it interferes with the liberty or autonomy of Y. So someone has substantial autonomy, and I say the word substantial because nobody operates with full autonomy. I don't want to get into a philosophical discussion about, do we have free will, right? Some people think everything is determined already, and we have no free will. But omitting that concept, everybody has different degrees of free will or autonomy, if I could say that. But essentially, I'm operating against your autonomy by doing something or omitting something like hiding the pills from you, okay? And I'm doing it for your own good, right? So quarantine is not paternalistic at all, right? No one enjoyed quarantine, and no one gets better psychologically or physically by being quarantined. And so that's not paternalistic. It interferes with liberty, okay, but it's not paternalistic. HPV vaccine interferes with liberty, and you're doing it for their own good. And same thing with obesity. Actually, obesity, well, yeah, I mean, we're trying to do it for their own good. So what's, so three things: has to interfere with a person's choice or opportunity to choose. The objective is to further the person's perceived good or welfare, whether he believes it or not, and it's without the consent of the person involved. Now, soft paternalism, so what's soft paternalism? What do we mean by that?
When it's, more of an inhibition of the choices or decisions that they make rather than like infringement on their freedom.
So inhibition of their choices.
So, for instance, you have choice A, B, C. If they believe C is bad for you, then you're limited to just A and B. So.
Okay. So you're taking restricting choices.
Yeah.
Okay. Other thoughts? Yeah, Emily.
I think the key to the difference between soft and hard paternalism is with soft paternalism, you're assuming that people are not fully informed, are not truly acting autonomously.
Right. Okay. All right. So, right. So, classic example is children. We assume that they don't have, they're not fully informed, or they don't know what their best interests are. They always live in the present, don't think about the future, and so we have to make decisions for them. And they're not, again, they're not fully autonomous. So soft paternalism doesn't, I mean, I know authors in some papers use the term soft paternalism to get to the point of, well, we're not banning stuff, we're not taxing stuff, we're just educating you, we're just restricting your choices. You know, it's like less intrusiveness. Soft paternalism doesn't mean that the act you're doing is less intrusive. It just means that your justification for doing that act, whatever that act is because you don't believe the person, him or herself, is capable of choosing wisely. Okay? If that makes sense. I mean, that's the justification for doing something for someone's own good is because you don't think they're able to choose wisely. So with will, lack of will, it could be because of limited information, limited willpower, right? That's what the obesity epidemic is all about, right? Limited willpower, right? Chris, right? You had limited willpower last night, right? You just ran right down to the store. And, right? Strength of will, preventing irrational choices. So lifestyle is not a matter of conscious choice. And protect individuals from non-voluntary choices. So we got that example again, selling oneself into slavery. I mean, we talked a little bit about that 2 weeks ago, and I don't want you to think that I'm just like fixated on this idea, but I mean, essentially, some people would say that even if someone was rational, or actually, some people would say that if you want to sell yourself into slavery, that can never be rational. Now, if one thought that, you know, if I gave you a deal, you know, $100,000 a year to be my slave, someone might say that would be rational. I'm not going to ask for a show of hands, but if that was the case and you interfered with that person, that would be an example of soft or hard paternalism. You thought that person was rational.
Oh, that would be hard.
Yeah, that would be hard because you're acting against that person's will. In soft paternalism, the person lacks will, and so you're not acting against the will. The concept is that if that person had enough information, had strength of will, that person would make the right choice. Okay, so if you think you're dealing with a person who is rational, and for whatever reason he thinks his or her interest is to eat unhealthy food, and he interfered with it, then hard paternalism. Of course, then it could be counterintuitive. Just like with slavery, one could say it's never rational to eat fatty foods. Sorry, Chris. It's just never rational. And then, I mean, if you interpret it that way, then you could say that everything we're doing is soft paternalism. Now, having said that, however, let me just skip that. So here, rather than text, I'll show you a table. So we could classify our actions into 4 categories, right? Based on whether voluntary or non-voluntary, or, you know, without will and with will. And our actions are either, you know, and sometimes it's not clear, bright lines, or substantially self-regarding or other-regarding, meaning it has effects on other people. All right? So which box would be an example of hard paternalism? If we interfered with
Number one. One.
Yeah, one. Where now it's why isn't it two?
Well, both types of paternalism are in regards to something that's an action that's affecting yourself and not others. So that's why it would be self-regarding.
Right. Yeah. So I mean, we're doing it for their own good, and so it's one. Here we're preventing harm to others because we don't want that. That's why we quarantine somebody, right? It was. I mean, we could say this: acting. Well, yeah. It's liberty restriction, but we're not doing it for their own good. Now the other way to look at all this is so let's try out some examples. On one hand, we could justify soft paternalism, right? The person is not making a good decision because of lack of willpower, lack of information. They don't know what their interests are. They're not thinking ahead into the future. So soft paternalism is very easily justifiable. And the question is, how do we justify hard paternalism? Could we justify hard paternalism? So what's an example of a public health practice that's an example of hard paternalism, where you think someone is actually, you know, working with all four burners on, okay? Jennifer?
The example you gave was transfusions for Jehovah's Witnesses, I think you said, was hard paternalism.
Right. The example I gave was, you know, for the kids. That was soft paternalism. So hard paternalism in that case would be if we transfused an adult, right? So let's think about that. Is that right? The Jehovah's Witness came and said no blood, and we gave him the blood. Is that an example of hard paternalism? So it's against the person's consent. It's for their own good. Our conception of the good. Their conception of the good is that they get blood, they'll be damned in hell. But we can't relate to that. Okay, we're talking about the medical good, and it's against their will, and it's a religious belief, and but you know, they're rational. Now, I mean, 20 years ago, we didn't believe that. We didn't believe that there, you know, people who ascribed to the Jehovah's Witness faith was not rational. So we used to give them blood. Of course, now the Jehovah's Witness situations are always interesting because of, well, two reasons. One, so if someone came to you and said, listen, I belong to this cult religion and we don't believe in blood either. So do you not give them blood too? Well, just think about that. So, I mean, someone, you know, says, you know, they believe in another type of religion that says don't give blood, and we've never heard of that before. Yeah.
I wonder, so if someone has like a DNR statement and you still resuscitate them, is that hard paternalism as well? Like if someone chooses not, like if they're on life support, they don't want to be brought back.
Yeah, right.
You bring them back anyway.
Yeah,
Is
well,
that
as I told you,
as well?
most of the times we don't bring them back. But anyway, that's another story. But but as I alluded to before, well, I mean, there are times when you know, I was recently asked to see a patient on the ventilator, and he was awake, alert, on the ventilator, just had a heart attack and a stroke, and he wrote on a piece of paper, you know, he wrote D and R, okay, wrote on letters on top of each other, okay, and it was hard to communicate with him if he really understood the situation, whether he understood what was happening to him and all that, and we thought that since we couldn't have a discussion to really understand his reasons, we thought that we couldn't determine with enough certainty whether his wishes were autonomous. So we interfered with it. That was soft paternalism. Okay. So anyway, so now what about public health practices? So let's talk about seatbelts. Is that if we, I mean, there's a law, right? You got to wear the seatbelt, right? So is that hard or soft paternalism?
Seatbelts and helmets used are sort of hard paternalism because.
Okay, all right. So seatbelts are. So how do we justify hard paternalism? We could justify soft paternalism. So and don't. I mean, you could use the economic card, but let's not use the economic card. Okay. All right. Any other way to justify? I mean, how do we justify hard paternalism? I mean, what would be an argument?
Morbidity and mortality of the person. You decrease the rate in seatbelts. Well, to that individual person.
Right.
Okay, so so what's that?
Can we add the degree of harm that might be caused to others? This is what mostly defines hard paternalism.
Well, with the hard paternalism, we have to justify. I mean, there's no direct harm to others if you don't wear your seatbelt, as opposed to the HPV vaccine, right? I mean, you could harm somebody else. So we could justify hard paternalism in that case by saying, we don't want you running around with the HPV virus. But with seatbelts, again, not talking about the economic card, the only way to, well, I mean, for sure the person could be harming him or herself, but is that just is that in and of itself justifiable to make them wear the seatbelts? Yeah, Katie.
Maybe because you're not like forcing them to wear a seatbelt, you're still giving them a choice. So if you don't wear a seatbelt, then you could get pulled over and you could have to pay a fine and your insurance. Well, see, yeah, you're still having the choice.
Well, yeah, you could call it a choice, but then it's kind of like it kind of like starts smelling like coercion there, right? If he or she says no, they might be in a worse off situation, right? $50 fine or whatever it is. So what I'm getting at is that we want a mechanism to make sure that we don't go crazy. We don't go crazy with hard paternalism. So what behaviors do we feel justifiable in restricting. So I have here 4 categories here, and so is it if something was of intrusion means intrusion in their liberty or autonomy, okay? So let's say well, let's say well, the seatbelt would be in which category? So which, in terms of harm to the person and intrusion in their autonomy or liberty? So which box do you think the seatbelt would go in?
I mean that due to accident, if the person is not wearing seat belt, the harm could range from low to high depending on the intensity of the accident.
Intensity of what?
Intensity of the accident, the magnitude of the accident.
Sure, but what's the potential? And here we're getting into probability, and sure, I mean, if they just dent the curve, then, but, I mean, we're talking about worst case scenario. And this, you have something?
Yeah, high harm.
Yeah, it could be, yeah, well, we're worried about high harm, and is it low intrusion or high intrusion in their autonomy? Yeah.
Too intrusive to our
What's that?
Low intrusive.
Yeah, right. I mean, right. I mean, we're not. It's not very intrusive. So one could say that you know, if something was of low harm, I mean, all the other categories. Well, these 2 categories would be off limit from public health actions, right? Low harm, right? I mean, what would be a low harm that we wouldn't care about? There must be something we don't care about if they did something. I mean, well, I don't know. We don't go crazy. I don't know what the. There's lots of things we do low harm. What is it? Yeah.
You have to brush your teeth for 3 minutes morning and evening, or the dental police will come after you.
Yes, right. Okay, very good. Yes, right. And that might be a high intrusion, but it's low harm. That's why we don't have the dental police, right? It's low harm. Okay. All right. So, and then if something was of, what about this category? High harm, high intrusion? Yeah, Chris?
I guess that can be more so looking into the future, like they were talking about. So self-driving cars could have a mechanism where you wouldn't be able to drive it unless your seatbelt was engaged, or you wouldn't be able to take it past a certain speed limit. Therefore, you wouldn't be able to, like now you can theoretically still drive and not have your seatbelt on. So it's low intrusion, but technically they could design something that wouldn't be possible.
Yeah, I guess if they built a car that all of a sudden wrapped you up with well, they used to have that, right? Where
they're making a lot of technology like that now.
You turn on the car and this. I think this thing used to strap you in, right? Right? And it just seems highly intrusive, right? So, well, we might have to think about this, maybe, right? But for sure, this category, I think we could justify that. Well, you may think it's in your interest not to wear a seatbelt, but you're probably wrong. You're probably rational, but you're probably wrong because but you know, we're going to mandate it anyway. Now, vaccines, again, you still have the other people. You could still justify by saying you're protecting other people, texting while driving, right? You're trying to prevent harm to other people. What about eating nutritious foods? Again, I think I guess that could fall in one of these two categories? Or what do you think? Or which category do you think this falls in? All our efforts, I guess it depends on what the practice is, right? It could be high intrusion. Do we think it's high harm or low harm?
It could be low or high.
Right, but then it's just like the accident, right? It could be a minor accident. So I guess stuff that falls in this category are okay. I mean, we're justified to do it. In that category, and things that falls in here, well, we'll have to think about it. You know, there's actually another element to justify hard paternalism, and this is the concept of collateral paternalism, where, well, and this is how this goes. We think a lot of people out there are just don't know the benefits of wearing a seatbelt. Okay, or we don't think parents are doing a good job of strapping in their kids. Okay, we want to do soft paternalism for them. Okay, however, we can't have a law that says, okay, if you're a rational person, you don't have to wear a seatbelt. We have to have a general law. And I'm sorry, Bill, I know you don't wear a seatbelt, but you have to wear a seatbelt, and you're just caught up in our public health practice of mandating this. It's almost similar to water fluoridation, like that's well, I mean, one could call that paternalism, but in terms of if there was no other means to get water, that person who feels it's a restriction on his or her liberty is caught up. It's caught up in our effort to protect the public. So there's that concept of collateral paternalism. We realize that some people might, could make a rational choice to be fat, okay, and a lot of people do. A lot of people do, and they're rational, okay. But we're going to have this law to ban trans fats or whatever, okay, and you're just going to get caught up in the effort, and that's called collateral paternalism. In order to protect people who can't make healthy choices, you're caught up in this practice. Does that make sense? So that's called collateral paternalism. This slide you could read on your own. This is just for a 6-step justification for hard paternalism, but I'm not going to. So what is the justification of behavior modification technique? I think right. So, whoops, sorry. All right, so just to review, it could be harms to society, right? And then we could use the economic card, right? Broad concept of the harm principle. And then we could say, well, we want to do hard paternalism. Actually, soft paternalism, just thinking logically, should go first. So we could say it's soft paternalism. We want to protect individuals from their bad choices. Many choices are impaired in some sense, and we'll talk more about this next week. Social determinants of health are not under the control of the individual, and we got to help them out. And then there's hard paternalism, You know, you're making an irrational choice, but it's low intrusiveness, just like the, you know, the helmet laws. You know, you want to, you know, yeah, we know it's a restriction on your liberty, but, you know, if you want to feel the wind going through your hair, you know, buy a fan instead, okay? Don't drive a motorcycle without a helmet, okay? And then we'll talk also, the other thing I think, Jennifer, you were getting at is the welfare of society, and we'll talk more about that, but we're stuck on hard and soft paternalism. So let's, I think, yeah, right, so show the results of the poll. All right, so you have to, if I didn't put that down there, I would never get there. All right, I don't think I have to talk about those slides. All right, so let's see what you guys thought about the, all right, so, okay, so in terms of public disclosure, so, oh, there it is. State the degree with which you agree or disagree that the following public health measure is, you agree with the following public health measure to control obesity, and most of you thought the public disclosure to require food manufacturers and restaurants to disclose nutritional content. Most of you agreed, yeah, that's a good thing. Okay, one person was neutral, and nobody disagreed. Okay, so that's relatively non-controversial, right? Okay. Anybody who would like to disagree with that? Go against the crowd? Okay. No? Okay. All right. Okay. Good. So, all right. So, what about surveillance? Well, most people agree. That's relatively not too much. I guess there's nobody here crazy about privacy. That's fine. No problem. Okay. I'll get back. So, so let's well, let's fourth liability, suing the oh, okay. So about suing the companies, right? That's what that's about, right? So I'll put down neutral, and so most of you agree with that, okay? All right. So no problem with that. Okay. I have to get to the controversial things here, which is things you must be in law school. Well, let's look at taxation. Okay, all right, finally. Okay, so 12 agree, 6 were neutral, and 3 disagree. All right, so what's up with taxation here? I mean, we had that case. So what do you think about taxation as a means? What are the arguments for and against it?
An argument against it is for those people who live in food deserts and have no access to any food but calorie-dense, nutrient-poor food. They are going to bear an unreasonable financial burden, and they tend to be poor and can't handle the burden, so it increases disparities.
Frederick? Oh, okay, I'm sorry.
Unless there is universal access to healthy foods. Taxing nutrient-poor foods can increase disparities.
Okay, all right. So, okay, Frederick? You have
I agree, but in light of what you're saying, I mean, if you put taxes on it, wouldn't it change their behavior towards getting healthy?
Would it change their behavior?
Yeah, towards getting healthy.
Okay, well that's a good question. Diane?
Against it because what about people who aren't obese who eat these foods in moderation? Like I like my Oreos, so I don't eat an entire pack in a day. That affects me because I'm being taxed on a behavior that I know how to control.
Okay, well then I would I say that you're being a victim of collateral paternalism.
Exactly.
Now, sorry, but now is this paternalism? How paternalistic is this? And well, I mean, is it first paternalism? Okay, is it hard or soft?
It's hard for some reason, depending on the group. So people that are obese, that they will be self-paternalism. So that then cause their behavior that they can do from health.
Right. So for
and for his case, I think it would be
hard.
It'd be hard.
Hard, right? Yeah, because he wants to eat that Oreo cookie. He has a he. Yeah, right. Yeah, and so are you saying that obese people, by definition, are non-voluntary?
I mean, with the study shows that most people that obese
sounds irrational to me, except if they do it in moderation, right?
Yeah, most of the time they don't do it in moderation. So that would be
okay. Of course, it could be. Of course, I know you don't want to generalize, but even, I mean, people, as I said before, some people like to eat and they don't care, and they, I don't know, want to play Santa Claus every December, and so this would, we would still justify by saying it's a low intrusion and preventing great harm, but then Emily, you're saying it might be great intrusion on them because of the, it's a regressive tax, hurts the poor people the most, and would now justice plays two roles here. One, people say, well, they're costing us a lot of money, so it's fair to put a tax on, and other people say it's a regressive tax, and it's not fair. So, I mean, one could say this would be high harm, high intrusion, right? Would that be a case of that? Yeah.
But are you just taxing to change the market demand for whatever the food is, or are you taxing for, to try and change something in the way that money could be spent? Could be spent to promote other initiatives that would promote better health for them.
Well, it all depends on how we use the tax money, but the major purpose is to change behavior, right? Right, by using the taxes to, and studies have shown that cigarettes are more elastic than food, right? You got to eat at some point, right? So, I mean, studies have shown that the cigarette tax has decreased consumption, and even the tax on sodas and stuff like that, studies have shown that those decrease demand. So that's the purpose of doing this. You want to change behavior.
I'm not disagreeing that you're wanting to change behavior, but you want to change behavior to something more healthy.
Absolutely, right.
Right, but so
and Emily's point was, if they don't have a choice, if there's no healthy restaurants anywhere else, then that's kind of unfair.
Right, maybe it's wrong for me to assume this, but I would think that the monies that would be raised from these taxes would go towards getting the foods that you would like to be promoting for these individuals.
Well, that would certainly make sense. I mean, I actually, that's a good question. I don't know. I mean, the thought is to use the tax money to, build playgrounds, stuff like that. I don't know if the government wants to get into the restaurant business, but they can certainly fund local people to, you know, small business stuff. I don't think they do that, but you're right. One wants the tax money to go to good things. Anything else about taxation, Ashley?
One thing for it, and it's only relevant if you have the choice. A complaint about a lot of healthy foods, fruits and vegetables, is that they're too expensive. So this would help kind of balance that out, so that maybe people would say, well, if I'm paying that much for the chips, maybe I'll get some fruit.
Right, and then what actually happens, you think? You know, they've done studies where, like in schools, right, they try to push the vegetables. You know, they've done studies in which they, you know, position is very important, where you position this stuff, and they would put the French fries in the back of the counter and the fruits and vegetables in the beginning. Well, do you have any? All right, so talk about paternalism. Anyway, and the kids still reach for the French fries. Also, they've done studies in which they build the healthy restaurants in the communities, and the people are still eating the Big Macs and all that. Yeah.
I think going in what Ashley said, one of the articles said, instead of raising the cost, why don't you lower the cost of healthier food? So that,
right, sure.
Because I think nowadays, especially, people buy things with money in mind. So, you know, you could get a salad, like one of those salad bars at Giant, but if McDonald's is across the street and you pay $5 for lunch, as opposed to maybe $10 for a salad, you're going to go to McDonald's.
Right. And so if you did that study, what do you think the results would be?
I would think people would go for the cheaper, unhealthier thing, because right now they're
no. Let's say you made the healthy food the cheapest thing.
Well, I think it would work.
You think it would work?
I think it would work.
Okay. Ashley, what do you think? Do you think it would work?
I think it could, because they've actually have in some schools replaced some of the vending machines and things and had salad bars instead, and the kids actually like doing it because they get involved with what's going on their plate and put it there themselves. But I think there's potential that it could work.
Yeah, right. Well, that doesn't involve money.
No. Well, it doesn't mean it's expensive.
Yeah, it might work. Yeah, Jennifer?
When you have food stamps where people receive $3 a day to go find food, they're going to go for the most they can get for their buck. So as I said, if it's higher price for the foods, they're not going to go for that. You have 50 million people that are food insecure in this country. They're going to go for whatever they can afford, and if that's what they can afford, that's what they're going to go for. And when you have that compounded with a lifestyle that perpetuates that, you're just not going to be successful with just putting a tax on it.
Right, they're going to buy it anyway. There was a controversy. I'm trying to think of this, and since you mentioned food stamps, I'll try and dig it up. But someone was trying to pass legislation to restrict what you could buy the food stamps with. Isn't that in a sense like you couldn't buy the unhealthy stuff with the food stamps? Does that still exist?
Yeah.
Oh, okay. So there's a restriction on what you could buy. Okay. All right. Well, what do you think of that? Yeah.
I realized one time I was in the grocery store, the one person with 2 cents wanted to buy the healthy food. I was asking him if I had cash to give him for the equivalent or a little less than the worth of the 2 cents. So I would use the 2 cents and give him the cash to buy whatever he wanted. And I'm like, I'm not saying I'm doing it.
He wanted to buy the unhealthy stuff. I see. I got you. Okay, we won't ask you what you did, but anyway.
They buy the healthy food with the food stamps, and then they'll pay for all the unhealthy food separately with their own cash.
Yeah.
Oh, yeah, okay, all right. Okay, well, what do you think? Is that liberty restricting thing a good thing or a bad thing? About the food stamps, should that be on the table to restrict choices with the food stamps? Okay.
Yeah, I still think there's a merit in restricting what they have with the food stamps because, number one, it's more healthy for them to, right. And then on the other hand, allowing them to go the other way is like countering what you're trying to prevent. If you give someone money, free money to buy something healthy, that's for their own good, to promote good health. And if you allow them to use it for something different that is less healthy, then you will have to pay for the cost of whatever comes after that. So not just that it's cost effective, it's also, I don't know if I want to say morally right, to have them do the right thing, because that's the whole purpose of spending the people's money. You don't want to encourage bad behavior.
Yeah, but let's think more about that. There's something about some people say, yeah, if you're going to use public funds, we're going to, make you eat right. But anyway, let's. Anything else about taxation? So a lot of people think it's taxation is a good thing. Okay. All right. So let's see what else. Okay, food prohibitions. All right. So what do we have here? We have 8 agree, 8 are neutral, and 6 disagree. So what's up with that? You don't want to prohibit? I thought you guys were getting into a paternalistic mode here, and some people are disagreeing.
Could you read the question? Yeah.
Oh, well, yeah, this is about, I'm sorry, this is, say, degree which you agree or disagree about food prohibition, like prohibiting restaurants to limit foods that like has trans fat in it. Yeah.
I voted against this one. I thought that you should still be allowed the choice. It should be available whether or not you choose to do it to be your own. But you need to be educated as to what would be the harm, but not necessarily restrict.
Jackie?
Well, we already put restrictions when you as like a restaurant, you have to meet certain health food standards, and your food has to be prepared certain ways to avoid health hazards. So
We want it to be safe.
So I think this is another way to make sure the food that you're eating is safe, because these things are proven to be hazardous. And they just want to use it because it's probably cheaper and it's available.
Okay. Frederick?
I think I voted for because my thought was before you probably go to have paternalism, you probably would have tried other intervention. So I'm thinking people are aware that these foods are bad, people are aware that you need to modify your behavior and it's still not working, so you might as well go the hard way. That's why I voted.
Okay. Jose?
I don't know what you said. I voted against it. I don't think they should be with people's choices to pick whatever food they want to eat. Instead of they should make maybe the portion size into smaller portions, or they shouldn't just pick food that have trans fat in it. There are other foods that we have just like and that can cause just like and negative effects just as trans fat can cause. So I think picking that particular food to burn it, I don't think it's justified.
Oh, okay, you don't think it's justifiable. I mean, this is a big thing against the food industry, and people want to have tasty food. Yvonne?
I mean, in response to what she's saying, what's the difference between inhibiting a portion size compared to trans fat? Like, if I want to eat, you know, a larger portion, aren't you, you know, infringing in my liberty to eat more than, you know, this?
Yeah, that's right. What's next? The portions, right? So we'll get the portion police out there, right? And in fact, actually, so I did. Where is it? Let me bring this up. So actually, in terms of where's the well, we'll go to the ads, but in terms of there was this article here about trans fat bans and human freedom. You know, this guy Resnick says, okay, there's two arguments for the ban: public health, right? Promote the public health, economics, and then the arguments against, well, this is a restriction of freedom. I mean, it's hard paternalism. A lot of people out there want their trans fat. They like tasty foods, and then there's this slippery slope. What's next? What's next if you start banning trans fats? Yeah.
I mean, it will be too much against free business. I mean, it will be having hard negative impact on the business, because if you are not having like tasty food or food which the consumers like in the restaurant, then why they should bother to go to the restaurant and cook an unhealthy food at their home?
Oh, well, yeah, the restaurant business will go out of business. Maybe yes, maybe not. So what about the, okay, measures in the school and the workplace? So yeah, most people, no problem with that, right? Okay, and what about the, well, okay, the built environment, you know, making playgrounds and building walk areas. A few people disagreed with that. Zoning laws to, I guess, make it easier for restaurants with healthy foods to go in, and well, most people thought that was good. Well, some people, any controversy about that? The built environment, you know, zoning for playgrounds, walkways, stuff like that. Now here, this question I put up this morning. I realized I didn't have this question about ads. The stated degree to which you agree or disagree to the following public health measures to control obesity: ads that try to dissuade people from eating or being obese. Okay, I just put this up this morning, so there's 8 responses. I knew I could depend on you guys to vote late. Okay, so agree, this is neutral, and disagree. So what's up with the ads? Is ads, public health ads? Okay, so what's good or bad? Yeah, Jackie?
Well, I think they're good. I mean, they're educating people on what the right choices are. It's not very invasive. I guess the only question would be who would be responsible for the funding to do that.
Okay, well, so here's the ads. Here's some of the ads, right, that's out there. What do you think? So, education, shaming, or interference with autonomy?
Yeah. I think the one thing against it that will be the shaming or feeling of guilt for some people who don't have access to healthy foods or healthy behavior due to some of the restrictions they have. So they may feel guilt of not having healthy choices and prevent their obesity.
Well, I mean, the issue is stigma, right? I mean, well, I mean, there's a lot of, I mean, what's the difference between these type of ads and cigarette ads? You know, you've seen them. I mean, you know, to control cigarette smoking, maybe I should put them up, but, you know, show, you know, people with, I don't know, the lousy teeth or their head and neck cancer, post-surgical, and, you know, crossbones, or people on the ventilator. So, you know, one of the articles talks about the shock value, right? And so the concern is that, you know, if, I don't know, 20% of the kids are obese, how do you think they feel if they see an ad like this? Yeah.
One big difference is willpower. I mean, people don't all smoke, but people all eat to some extent.
Right.
You know, maybe they don't have the willpower to not eat like I do, and that's why they're the way that they are. Public perception just seems like it would be creating that stigma.
Well, no, I'm talking about the stigma from the ad itself. Just showing the, we're showing this ad to provide some shock value, right? But a lot of people look like this, and so are we trying to produce shame and therefore stigma? David, did you have something you wanted to say?
Well, I was discussing earlier that these ads are all geared towards shame and shock versus education as a goal, I think.
Yeah.
And they can be stigmatizing.
Right. Yeah. Now, does it interfere with autonomy? Is there yeah, see.
Well, I mean, going back to the ads, I mean, what were the messages attached with those pictures? I mean, was it like, if you sit in front of the TV, you're going to look like that? You don't want to look like that.
This one says, don't look like the back end of a bus.
That's not a good tailored message. That's just, you know, that's not.
That's not a good tailored message.
No, it's not.
Well, I don't know. What about this ad here?
What is he saying?
Does it need any words?
Yeah, I mean.
Where's the? I can't get the. For some reason, I've lost the presentation mode here.
It's something middle school mentality.
Yeah, it's like name calling.
Oh, that's right. Yeah, right. So I don't know, and you know, I mean, I guess this isn't too bad. I don't know what these people are supposed to look like, but I mean, is this is this now, is this persuasion or manipulation? Are we trying to do a little? Is this crossing a line? Is this doing psychological manipulation?
Hello.
Oh, Rolla?
Okay.
Okay, sorry.
It's okay. I just want to comment about these ads. I think if there is such a picture and an ad, and next to it is a burger, a big burger meal ad, the burger ad is more catchy for children or even sometimes adults. So what I think, there would be certain taxation on such types of ads on the streets or on TV. Ads for non-healthy meal, rather than having such ads all over.
So you think so what's your final thoughts about these ads?
I think these ads are not as much effective if they were available at the same time with other ads that are with heavy meals. Marketing ads, other marketing ads for certain type of food.
You mean healthy foods?
Sorry?
Have an ad for healthy foods.
No. I say no. I'm saying that if there were present this ad, one of these pictures, and next to it another ad for a burger meal, the burger meal ad would be more catchy. So idea is to decrease the presence of such unhealthy food ads that will give a great influence on eating habits.
Right. Yeah. Well, that's the. That's the point. We're trying to counterbalance the ads from the food industry, right? So, like now recently, there's been a change in like some of you posted these videos. What do Coca-Cola and Lance Armstrong have in common? Both recently shamelessly admitted on national TV to some guilt, though neither appeared very guilty. Now, Emily, you showed a. Oh, how come I can't? You posted a video.
That was not from the Coca-Cola.
Yeah, that's the Coca-Cola. Yeah, right. That was a good ad. Oh, here it is. Right. So, right. Here we go. Right. So, now. Oh yeah, that's the you posted the revised Coke ad, right? That was a.
It was from an activist organization.
Yeah, right. So I mean the concern. Let me see if I can't. How come I can't? I thought I could. Anyway, so. Here it is. That has. This is the new Coke ad. Only 140 calories. All right, so this is the new Coke ad, okay? I don't know what the heck that is, but anyway. So the concern, and then this was the Super Bowl ad. All right, and well, I don't think. I'll send you the link. But anyway, so the whole concern is that I mean we got the food industry doing all these ads and they're manipulating you. I'll show you the original Coke ad where I mean they say they have 600 different types of drinks. But they make 140 with 0 calories, and so they're really trying to fight the obesity campaign. And they say, well, you could, even if you drink the low sugar content with 140 calories, you could, get rid of that with 75 seconds of laughing, which is not true. And so they're giving you wrong information. Also, you saw the term 140 happy calories. Okay, what do you think they? What is it? Burger King, a Happy Meal, and they have psychologists working with them, and the whole concept of a Happy Meal. People want to feel happy with their lives. What could make you more happy than eating a Happy Meal? They're trying to fight this, the ad that's going on with the food industry. Now, could we? Some people say, well, are the obesity ads the way to go, or should we just restrict their ads? Chris.
The obesity ads were definitely excessive. If anything, it might just drive depression. But I think the other kind of ad, like the one Emily posted, was right on point because.
No, that's not a real ad.
I know.
Okay.
What I'm saying. It's not a real ad, but what
the ad we wish them to do.
It did still have a lot of shock value in it, and what it does is that you don't have to have a lot of money to reach a lot of people, so that spreads virally.
Yeah, but who's going to do that ad?
Public health organization? I don't know. They were a non-profit, I believe. I'm not sure.
No. Well, that wasn't a public health measure.
Sure.
Right. Yeah, but I don't know. I don't know if the government could do an ad like that. So anyway, here are the alternatives that you guys voted on, and you could break it down into three different categories. One is facilitative, trying to enhance choice, right, with disclosure, hopefully maybe with the ads, facilitate choice with the built environment. Then you have something that's more coercive, tort liability, prohibitions. If you sell the stuff, you're going to pay a fine. And then somewhat mixed: food marketing regulation, taxation, school and workplace policies. It's mixed in a sense that it's somewhat more restrictive than being just pure facilitative, but it's not as harsh as the other measures. So in terms of degree of paternalism, which well, I guess hard paternalism. I think we mentioned this. Maybe what did we say about taxing? Could be right. You thought it was hard paternalism. Right. Yeah. And at the very least, are all these things? Well, I mean, we don't want to sue people who eat. But at the very least, would all of this be considered soft paternalism? Try to enhance choice or restrict choice? And so we're in the soft paternalism business. Well, we already see that. Oh, yeah, one other claim. This is an article in The Atlantic last year saying, you're fat and you know it. Why government anti-obesity efforts will fail, meaning that, well, people know the health consequences of being fat. They hear it all the day, and they still choose to eat. And so, you know, this is, well, what is it? The Atlantic, somewhat of a libertarian journal, I guess you could say. And so, so they're saying that people, you know, this is really hard paternalism. People, they know they're fat, and they don't want to hear these messages. So taxation we talked about, you know, on one hand, redress inequity. You know, people are costing us money, so they should pay for their unhealthy lifestyles. Or it could cause an inequity issue. Or is it an act of paternalism designed to place economic burdens on those who engage in unhealthy lifestyles in order to change their behavior? And so that's a justification for taxation. So again, we're left with the, you know, the what's the ethics of or justification of behavior modification techniques? Is it again, you know, which, I mean, we have a list of things that we could use to justify. We got the harms to society, okay, the economic costs of obesity. Under the broad concept of harms, we could say it's hard. People do have a choice to eat, and it is hard paternalism, but it's low intrusiveness and high personal harm. So the taxation is as we discussed, could be high intrusiveness. But, well, we could use the soft paternalism card. People are not knowing what their best interests are. They really don't. Well, I guess as opposed to that article in the Atlantic, yeah, people know the bad effects of eating, just like people know the bad effects of smoking, but they do it anyway. And they just don't know their future interests, yeah.
I don't think people appreciate how bad some of these quote-unquote manufactured foods are for them. I mean, you have the picture earlier in the New York Times Magazine article about how about the food industry.
Yeah, right.
I mean, they talk about the science of the food industry and how people sit around and they design foods so that you become addicted to them. And like the Dorito, it's like the perfect crunchiness in your mouth, and I mean that's really a high level of manipulation. I don't think people totally comprehend how much we're manipulated by the food industry.
Well, right.
The actual manufacture of food, and then also the infiltration into society with the advertisements, the product placement in movies, and all that kind of stuff. I think we're really manipulated a lot more than we realize.
Right. Yeah. No, that was a good article. If you haven't read it, I only put it on the recommended list. But they would really go through a whole scientific analysis. They do focus groups and determined the right mix of taste and ingredients and they like for example, like, okay, you'll drink a Diet Coke, okay, but the whole concept behind that is that then the studies to show this is that people don't usually just only drink a Diet Coke. They eat something with it. Something in their brain discharges something to the eating center that they have to have a snack with it. Okay, and the same thing as you were saying in the article is that they know which foods. Well, they really know how to hook you on. Emily, you want to?
One thing I would argue in favor of soft paternalism is there is so little. There is such a cultural and social component to what we eat. I mean, look back to biblical times. You celebrate by killing the fatted calf. You have a big feast of fatty roasted meat. Up to this day, you go to a kid's birthday party, you have a cake, and you have soda. You meet up with somebody, you go to a movie, and you have chips and share popcorn. We are conditioned as social animals to bond with each other through food.
But it could be healthy food.
It could be healthy food, but we're also conditioned to celebrate special occasions by eating the less healthy and historically less available food. And we're now in a time when these unhealthy foods are substantially more available, easier to get. I mean, 200 years ago, when you wanted butter, you had to go out and milk the cow, wait for the cream to rise, and then go through an hour of doing this before you can get butter. I can drive to Giant and buy a pound of butter for $3.
Yeah, sure. But you said historically, what was easier to do historically?
Historically, it was harder to get these nutrient-dense or these nutrient-deficient.
Okay, yes, right. It's been manufactured, right, yeah. I mean, the recent study showed what, right? What's the best diet in the world? The Mediterranean diet, okay? And you know, coming from the cradle of civilization, right? I mean, they've been eating those foods for thousands of years. And, right, it was hard to get bad food, but it's a multi-billion-dollar industry. Oh yes, right. Let me end by, yes. So your views about choice. See, I knew there was a reason why I put these helpful slides on. There's that ad again. Maybe you don't want to see that. Or maybe you do. Let's see. Where is the... Right. Okay. So, what did you guys think about choice? Well, in terms of paternalism, do measures to curb obesity rates represent soft or hard paternalism? And some of you said soft, hard, and some of you said I want to go to class. So that was the right answer. Extent of individual choice. To what extent do poor individuals living in inner-city neighborhoods have a choice in selecting their lifestyle to avoid obesity? How many said, what is it, 6 said some extent of choice, and 16 said minimal extent of choice. So what's up with that? So, hey.
They can argue that in addition to there being food deserts or lack of healthy options, there's a lack of access to exercise facilities or areas to exercise, or even just violence in the area, keeping people indoors and in a sedentary lifestyle.
Right, okay, all right. And if I ask the question, what extent of choice is there in autonomy in selecting the food you eat, based on, you know, like what you said about what that article said about, you know, the manufacturing choice, there just might be, you know, really a lack of whatever, correct information, willpower, addiction. So what kind of choice do we have against the multi-billion-dollar food industry? So, well, let me skip that slide. So actually, and I'll end with this, in regarding choice. So how do we enhance choice? So getting back to Mills-Harm principle, I forget to tell you that in the next few weeks we're going to make some modification to Mills-Harm principle, and the stuff in italics are the added words. So the only purpose for which power can be rightfully exercised over, I'm sorry, that's supposed to be an, or over any, no, it's supposed to be any likely competent member of a civilized community. Mill had just said any member of a civilized community against his will is to prevent, okay, Mill said harm to others is to prevent unacceptably likely harm to others or to secure the benefits due to others. Okay, I have this in the handout. You don't have to copy it down. So we'll talk later on about this part, but here, likely competent. So what we've been discussing today is that in order to justify public health practices, it got introduced this notion of are people autonomous enough? So the question is, protection of persons with choice restriction, need to protect someone from their own decision. People may have limited information about risk, may have limited willpower, may face external pressure peer or environmental pressure. We didn't talk much about that, but we'll talk about this next week, where why is it when people actually have a choice in their neighborhoods, let's say if it costs the same, fat food and healthy food, they'll still eat the fat food. And then more importantly, people may have limited options due to their social, economic, and political environment. So a lot of restrictions on choice, and so yeah, I don't want to depress you all. I don't want you to leave this room thinking that well, maybe it is true. You know, maybe there is no such thing as free will. But when it comes to eating healthy foods, you just got to wonder, is there such a thing? And then now, you know, what's the job of public health? What's the correct way to change behavior? And I think I want to maintain. Where's our list? Right. I think there's I think the major things on this list. Well, actually, I don't think any of these things. I mean, some of them might be helpful, but I think we need to do more work, and so that's what we'll discuss. We'll start to discuss next week on how to compensate for the lack of choice, and how do we do soft paternalism? Okay, so that's for next week. Okay, great.